Everyone's time. Welcome to this wonderful opportunity for us to connect with our U.S. representative for the Congressional District, the 9th District, which is ours. Before we get started, I want to remind you that if you have additional questions of Congressman Griffith, if you would put those in the chat box. I think we've already received some, and Josie will be monitoring things on that side for us. I'm Sharon Scott. I serve as your Executive Director for the Montgomery County Chamber of Commerce. It is indeed a pleasure to have with us this morning the Honorable Morgan Griffith. He is the U.S. Representative for the Virginia's 9th Congressional District. He's been in that position since 2011. Prior to that, he served as the Majority Leader for the Virginia House of Delegates. He has his law degree, his JD degree from the Washington and Lee University. He is married with 3 children. He is from our community, and it is just a pleasure to have him. This morning's session, this program, is sponsored by one of our platinum sponsors, and that's ServPro. So thank you so much for joining us. Again, if you have questions, put those in the chat box. And as my staff would say, it's time for me to be muted. Thank you.
All right, who's next? Is it me? Okay. I'm glad to be with you all. As you might imagine, we're all trying to limit our activities out there in public, and that makes it sometimes hard for me to do my job in 22 counties and 7 independent cities. Montgomery County is the most populous of the counties in the 9th Congressional District. And so I wanted to we're doing different things to try to reach out to different parts of all of our communities as we go forward. And this is, I'm greatly appreciative of ServPro and their folks for stepping up and helping us with this as well. That being said, we can jump into questions here. I do want folks to know, because sometimes people think that because it has not been a perfect situation, that somehow Congress and the government were not trying to prepare. But the problem with trying to figure out diseases, particularly new diseases, is what do you do to prepare? So I just want to go over some numbers real quick. From fiscal year 15 forward, we increased funding to the National Institutes of Health by 39%, the CDC by 24%, the Advanced Biomedical Research Division by 35%, the National Stockpile, which has been, a lot of our issues have come out of there, 32%. And although it didn't start as soon as the others, the infectious disease response, we increased in fiscal year 19 by 70% in an attempt to try to be ready for whatever was next. That didn't work out because we didn't have enough PPE. We didn't have the ventilators that doctors thought we needed. And so we are where we're at. We have then responded. The first that we actually knew about the virus when it was reported was December 31st. I think it was the end of January, the 1st of February, when we had our first fatalities in the United States. And by March 27th, we were on our response bill number 3. That was the big one, the CARES Act. And we've now had a 4th one to replenish some of the funds that were previously allocated in the CARES Act to make sure we had plenty of money. So that's what we've done. There's lots of questions about the CARES Act. There's a lot of things going on within the CARES Act as the administration tries to tweak things, and I'm happy to answer questions and try to give you the best answers we have. I'm not sure, I can't see everybody because we have so many, which is good. I do have Emily Michael, who has a fancy title, but basically she runs the think tank shop in DC for me. She's on the line. John Beber, my district director, who's out of Abingdon, is on the line. Emily, do we have anybody else? Is JR or Emily Mace on the line this morning?
I believe Emily Mace is on the line.
Okay. So I may at times, if we get a technical question, I may refer to one of them to try to give me some assistance. That being said, I'm happy to open it up for questions. And who's going to be our moderator today?
I'll moderate.
Okay. And did you want to start with a particular question, or do you want to see if there's some folks who have questions live?
Let's start with the questions that we sent over to you yesterday, and then we can roll through those. And then if people have additional questions after that, then we can address those.
All right. Sounds good. Which one do you want to start with?
Let's just start at the beginning.
All right.
So I believe the first one was about someone who visited Myrtle Beach and hasn't had any symptoms yet, but their doctor thinks it's a good idea to be tested, but there's only tests for people showing symptoms. Is Virginia going to start testing on a more widespread scale, or is that not being considered right now?
Well, I can't say what the state of Virginia is considering per se. Now, to the governor's credit, he has had a weekly news call or informational call with each member of the delegation. The congressional delegation is invited, so we have all the congressmen and all the senators on the line. He gives an update, and then we're allowed to ask questions. They keep saying they've got plans, but I can't give you specifics. I will tell you it's been interesting to watch because different states have handled it differently. And because my district borders North Carolina, Tennessee, West Virginia, and Kentucky, I get calls all the time. And one of the calls we get is, why can't we have drive-through testing provided by the state? Tennessee is doing that on a county-by-county basis. They show up somewhere and anybody who has a Tennessee license plate can get a test. I'm not sure what Virginia's plans are. The number of tests has increased significantly. The turnaround time has increased significantly. I was talking with a number of hospitals the other day, and they indicated that when it first started, they were sometimes having to wait, 7-8 days to get results. Now through LabCorp, that was the one that these particular hospitals used. They say they're down to about a 24-hour turnaround time. Of course, if you have the Abbott ID Now machine, but this is where government gets crazy. If you have the Abbott ID Now machine, they can do it a lot faster. So here's the problem we found in Buchanan County. In Buchanan County, they already had 4 machines, but they couldn't get the reagents for the tests. It turns out that the only way that the Buchanan Hospital could get the reagents for the test was to get a new machine that came with the reagent. So they have 2 machines in the hospital and 2 at some of their ready care centers, but they couldn't get the reagent unless they got a new machine. So they had to get a new machine to get the testing capabilities, but that has helped quite a bit as well. I am hopeful that as we get tests going forward and we're working with CDC and FDA at the federal level, that we will be able to do the antibodies tests. And the lady specifically asked about antibodies as well. They are testing more people than those with just symptoms. There are places that are providing it even if you have no symptoms. You can go in and see if you have the disease. This lady has already gone through, and maybe a man, but this person has already gone through the quarantine process, and what they really need is the antibody test. First, we've got to make sure we deal with all the people who are sick. Once we get that done, we're working hard to get some accurate antibody tests out there. We still don't know enough about the disease to be able to tell you that if you have the antibodies that you will not get it again. But general science indicates that if you have antibodies for the disease, you probably won't get it again. I think a lot more people have antibodies than we can account for at this time, which is why I'm very hopeful we can get the tests out there. So anecdotally, I will tell you, I have a friend whose wife came down with COVID-19. They moved away from Salem and went to South Carolina, where they had a bigger hotspot than we had. But it just so happened that she started showing symptoms when all the kids were home and a couple of their significant others. So all of a sudden, they have 7 people in a 3-bedroom house, and they're all quarantined. She came out of it fine. She had severe fever. She had muscle pains that were very painful for her. But she's out of it. Everything's fine. Nobody else in the household showed symptoms. You can't tell me that at least half of them don't have antibodies, that they had it, just didn't never show any symptoms. And so they were quarantined for the full period. but they've never been tested. So hopefully as we ramp up, we'll be able to test. And a part of the reason I went through those numbers is that if you don't have a disease that you know exists and you don't have a DNA test for that disease because it hasn't existed prior to late 2019 in China and early 2020 in the rest of the world, there's no way that our scientists working at NIH or CDC could have had it prepared. I am getting ready to ask some tough questions of CDC. We have is that tomorrow? Tomorrow or early next week, we have an oversight meeting like this on electronically with the Energy and Commerce Committee on which I serve. I serve on Health and Oversight, and both of those committees are grilling the CDC. And the question I want to ask is, why did you think you all could handle this by yourselves? Because for the first 2 or 3 weeks, they cut out private industry so that Abbott and LabCorp and some of the others could not do the tests on their own, and other folks could not develop their own tests. Now we have a number of healthcare folks, facilities across the country develop their own tests. Those are very effective. The FDA's, approved them, but the first bottleneck was CDC making the decision that they could handle it all through their protocols and their decisions. And look, everybody makes mistakes, but I want to know what their thinking was so that we don't make that mistake again.
Thank you. And if anyone has follow-up questions, please, again, just drop those in the chat. So our next question has to do with the food supply chain and the fear around those. What can you tell us about this and how can we address it? Are there any local or regional infrastructure that can be established to help smooth that out? Or having a small number of extremely large processing plants seems like a distinct potential weakness in this person's opinion. So what are the plans to mitigate a food shortage?
It's complicated. The president has ordered that all the plants open up. The people in a lot of these large plants, I was on the phone yesterday with Secretary Azar, and he was indicating that a lot of times what happens is it's not necessarily that they aren't social distancing in the plant, but apparently they're all friends and family in a lot of these areas. The question came from a senator yesterday from Kansas, and they don't social distance within their communities where they live and have their families and so forth, and that created a greater spread in the meatpacking industry. That being said, we're hopeful to keep the supply coming. We've got to figure out some things. We have, at points we've had more milk than we've known what to do with. I haven't heard any local situations where it's been dumped. We don't understand why the price of meat has gone up, but the amount that the packers have been paying for cattle has gone down. There's some things we're going to have to take a look at over time, but we may have some shortages and some shortfalls come late summer, early fall. A lot of people are planting gardens in the time that they have because they can social distance. They're at home, so we may actually have a sufficient number of vegetables out there. But meat's going to be an issue for us going into the summer, fall. I don't think it's going to be severe, but you may go to the store and only be allowed to buy, one package of hamburger. That kind of thing I do expect to happen. And hopefully we can get through this fairly quickly, but that is going to be an area that we're going to have to continue to monitor.
Thank you. So the next question we have is in regards to the stimulus packages. And with 2 passed and another on the horizon, there's been a lot of added money to the economy that has nothing to do with COVID's impact on the economy. How do you see the new normal over the next 6 months economically?
Well, first we have to start reopening businesses. It's my understanding that the governor is going to take a look now at a regional approach. I have been encouraging that for weeks, and even in the beginning, I felt like in Southwest Virginia that we could have kept our schools open another week. And I said, wait a minute, you need to treat the state regionally. Subsequently, before he got asked in the press conference in our weekly calls, I said to the governor, you're going to get pressure because Bristol's going to open up on the Tennessee side, go to my favorite wing place on the other side of State Street. That's going to create a lot of stress. He did get a question this week about that and indicated he would take a look at a regional approach. It's my understanding also that he has agreed to allow dentist offices and elective surgery to come online. I think that's very important. All of the hospitals that I spoke with, and I have dozens, so I did not speak with all of them, but all of the hospitals that I spoke with were requesting that. They were indicating that we've been very blessed and very fortunate that we have not had many people who have had to been hospitalized. Of those who have had the virus, I have 3 counties out of that 22 counties in 7 independent cities that have no cases even as of now. Many of them have single digits. And I spoke with hospitals in the center part of the district with Galax and Buchanan, and they had those were the ones I talked to this time around, but that was, what was that, yesterday or the day before? They had one person that had actually had to be hospitalized. They had the rooms ready, they had enough ventilators. They felt like now we could get a spike, and they're worried that that might happen. But in the meantime, they're not doing any elective surgeries. The other thing that we're finding is, and I would encourage everybody to spread this word, because people are afraid of going to the emergency room and finding somebody there with the COVID-19, people aren't going to the emergency room. Anecdotally, each of the hospitals said, they told me about it initially, they have had deaths where they can't tell you for sure the person would have died, but they didn't call the rescue squad or they didn't get somebody to get them to the emergency room. And so they were telling me about cases, not individual names, but cases where somebody didn't call having chest pains. And by the time they finally did call, it was too late. They could not be saved. Same thing with brittle diabetics. They had one of the hospitals had a couple of cases where they had brittle diabetics who just wouldn't go to get the help they needed. And unfortunately, they passed away. So please tell folks that, it's safe, it's as safe as anything else you're going to do to go to the emergency room or to go somewhere else to a healthcare provider if that's what you need. If you need somebody, go get that help, because that's been a real concern as we move forward as well. I think I got off track on the question. If you want to veer me back on, that's fine. But I am believing that we need to get back on track. As far as monies that are spent, there's real concern that we'll spend more that doesn't have anything to do with COVID-19. We're trying to do the best we can in that regard, but this has impacted the economy so significantly that there's a lot of things that can be tied into COVID-19, even if it may not look that way in the beginning.
Thank you. Our next question has to do with PPE and how will a shortage be dealt with from here on out, and especially as the Commonwealth and other states begin to reopen and begin to have elective surgeries and all of those procedures that utilize PPE. How will things be prioritized in terms of who gets what and what surgeries or procedures are deemed most important?
I'm gonna look to the medical community to tell me what procedures and surgeries are most important as we move forward. PPEs, this is an area where I think we can take back part of our supply chain fairly quickly. The drug supply chain, and I know this wasn't a supply chain question, but it gets to that. The supply chain on actual medications is going to be harder to bring back to the United States, and I think we're going to have to do some infrastructure bills and some tax incentives to get drug manufacturers to bring that manufacturing back to the United States, at least a significant percentage, whether that be 35 or 50%. I can't say right now. We'll have to do some more study on that. But we need to have that in the United States, and it needs to be spread out in a couple of different places in the United States as well. So, for example, when we had 2 hurricanes in Puerto Rico, we had done tax incentives for folks to go there. All of a sudden, we had a risk of a significant shortage. Had this overlapped with those two hurricanes, we'd be in dire shape even on the stuff that's made in the United States and Puerto Rico. So I want to see us encourage those companies to bring manufacturing back here. That being said, on PPEs, once we get enough, I have been assured by the U.S. Trade Representative, he and I had a call together a few weeks back, and they were going to bring in stuff from China. I said, look, we're starting to produce it again in Southwest Virginia and other places. We need to make sure we encourage that. He gave me every assurance that once we get enough to deal with this problem, that we are going to make sure that we bring that supply chain back. There are at least 4, maybe 5 companies in Southwest Virginia who are making PPEs now. At least 2 and maybe 3 of those are looking at this as a new line of product. Gowns and masks in particular, because we do have the technology. And one of the companies that I know of is, this is what they did 20 years ago. So the son who now runs the company, goes to dad and says, where's the template? And I mean, they're up and running. And they're providing material to the Commonwealth of Virginia and to private industry. But, they see this as a long-term new line that was really an old line. They used to make gowns. They used to make masks. But we as a nation chose to go just on the cheap and not expect something like this. And nobody could compete with the labor costs in China and Asia. So we're just going to have to figure out how we make sure that we keep those folks who've stepped forward and are ready to develop new lines making those products. And the only way we can do that is for them to have contracts to provide that, at least to the government, if not to private industry as well.
Thank you. Our next question kind of ties back to the previous one. We're jumping around a little bit. But as the economic reopening implementation begins, what measures are going to be taken at the federal level in an attempt to continue to flatten the curve? This person says they understand the importance of people being able to work, but if someone is in a high risk group, are they expected to go back to work and hope for the best, or will there be continued benefits for those who have a documented history that places them in the immunocompromised group of people?
It's a great question. I don't have an answer. We have not yet considered that. So I don't want to mislead you and tell you, oh yeah, we're on top of it. But the fact, and this is why these kinds of meetings are so great, that question has not come up to me before. I have Emily Mace, my health staffer, on board. She's making notes of this as we speak. We will pass this on to the health committee as a whole and start the government taking a look at what do we do for people, because that is a part of reopening. If you have some comorbidities and you're in the age bracket, what are we going to do going forward? I'm in the age bracket on the low end at 62, but what if I were 67? What do we do in that case? And what if I had other comorbidities? It's a great question. I wish I, had thought about it before last night, but I'm not going to mislead whoever asked that question. But the fact that the question was asked will now give us the ability to come up with some answers for that. And I think that as we go forward, we're going to have to do something in that regard, because to expect, the 30-year-olds to go back to work and to start, producing what we need to and get the economy open, absolutely. I think we need to do that with proper measures as suggested by the CDC, still trying to do distancing, wearing masks where appropriate. But just like I don't think we'll ever go back to doing the same things at nursing homes where people just wander in, I think we're probably going to have take people's temperatures before they come into a nursing home in the future. I think we're probably going to be wearing masks for some time in the future at nursing homes until we figure out what we're doing. But it probably is just a good thing to do anyway when you have such a high risk population. But also within the workforce, we have to take a look at that. So we'll be working on it.
Well, thank you for your continued commitment to looking into that and bringing that to the attention of the powers that be. Our next question is about broadband, and the disparities in broadband access is truly accentuated during this time. And the urban-rural divide only continues to grow each day in this current environment, with limited access to broadband in rural areas. Is in the next tranche of federal funding, what can be done to address broadband and address those disparities, especially as kids are now being educated at home.
Yeah, this is a difficult area. It gets into one of the other questions too. But what we're going to have to do is there's already money for telehealth in the bill. We put a lot of money in. A lot of people are using it, but it doesn't do you any good to have telehealth if you don't have the broadband available. We're also finding that there's a problem with seniors who don't know how to access. And it comes in all kinds of different ways. So we have people using telehealth, but because they have patients who either live in areas that don't have broadband, or the patient does not want to learn how to use a computer, or doesn't have a computer, or even a smartphone that they might be able to do face-to-face. We were urging yesterday Secretary Azar to revise the rules, because they're only reimbursing the healthcare provider if they can see the patient over telehealth. Well, for so many of our folks, it needs to be done telephonically. They can do it, they can talk to the patient and so forth. And obviously seeing them is better, particularly if there's a lesion or a sore or something like that. But if they don't have access or they're not able to use it, we're thinking that they ought to be reimbursed for telephone. So I would expect to see that in the next tranche as far as telehealth is concerned. One of the other things we can do is to maybe make the regulations a little bit easier on some of the new technologies, because we could put, you could put any number you wanted to down. One of the last places that's going to be served are going to be some of the nooks and crannies or hollers in Southwest Virginia and Eastern Kentucky. Central Appalachia is going to be the last to get service if we go with traditional broadband, which is by cable or wire. But we have white space technology that Microsoft has that may be a possibility. And we may be able to ramp that up by giving some money to encourage folks to do that. Likewise, although they're still probably a little bit out, we can look at ways we can increase the speed of high altitude or low orbit satellite systems. There are 3 companies working on that now. They should be in the field by 2021, but right now one of the companies was telling me late 2021. That would cover everybody outside of the metropolitan areas. It would cover the metropolitan areas, but they can't compete there. But when you talk about the 9th District and other parts of the country that are fairly rural, this low orbit satellite technology is going to be revolutionary, but we're just not there yet. So we're going to look for ways that we can change the regulations. I don't know that any additional amount of cash would help them, because it's a matter of getting the satellites in the air. It's not a matter of the money. That's why there's 3 companies competing. They see 100 million people between the West Coast and the East Coast. They see folks in Canada and other parts of the world, because this will be a worldwide system. There's a market there for what they're doing, and they're all racing to see who can dominate that market. That's good news, but we're talking late 2021, and that's their optimistic projections. We've got to see what we can do to maybe speed that up.
Thank you. Our next question is about the IRS call centers. Do you have any information on when those will open back up? This person's concern is that there's special circumstances that can't be handled or found in the online resources. So do you have any idea of the timeline of that reopening?
I don't. It's very frustrating. We have pushed, and I've signed on to a letter saying, come on, people, let's get this thing together. Because right now the call centers aren't operating. And if you don't have access to a computer, that's the other question that broadband issue touches on. If you don't have access to a computer, you're not able to file the paperwork, and the people need the money now, while they will eventually get the money. Everybody's confident they will get it, even if it's, sometime next year. IRS says, oh yeah, we'll take care of it when you file your taxes next year. No, they need the money now. We have appropriated the money now. We want the money out there in the economy, so that when things do start to open up, people can go do the things that we need to have done to get the economy rolling. I can assure you that both sides of the aisle are very frustrated on this. We're putting pressure on the IRS. They have a manpower problem, which is why they haven't reopened. You know, but if you had a stock question and a stock answer which you can get by calling in, you wouldn't need to talk to somebody. I mean, again, hopefully within the next week or two, but I can't give you a specific date. The IRS has not committed to us a specific date, but I can assure you that on both sides of the aisle, they are getting a lot of pressure.
Oh, thank you for that. We have a couple more questions here, and then I believe we have at least one in the chat. So our next one is kind of a bit of a long one. The U.S. Economic Development Administration has made numerous significant investments in the region's economy. For instance, CRC Phase 1 and 2 received funding to support construction of the initial buildings. And our region will be relying on EDA funds to help our employers and employees transition safely back to work. However, the EDA can be slow to operate. We are still awaiting a notice of funding opportunity for the CARES Act funding. Realistically, we are more than 60 days out from funding being available once a successful project moves through the federal system. Can you encourage the political leadership of EDA to expedite the notice of funding opportunity and forthcoming applications?
We can. Emily, Michael, put that one on your list of things to get done.
Yes, sir.
Yeah, we will certainly encourage them to do that, and I would expect that this is an area as we move forward. I'm hopeful we'll finally get an infrastructure bill. All of these things become difficult as each side does the push me, pull me to see what they can get in, and we want to do something that actually makes sense for the country long term. But we'll try to speed them up. I think we have a template in the PPP program. While not perfect, the fact that we opened it up to having private businesses, that would be all of your banks, all of your banks, but the small banks actually did pretty well in the PPP program. But what we did was instead of saying it's got to go through the agency and jump through all these hoops, we expedited the process and we gave it to the folks in the community, and they did a darn good job. The local folks did a good job. We've got to figure out ways that we can do that and replicate that. It won't work exactly the same way with EDA, but I'm hopeful that we'll be able to do some of that now that we've seen that that's a much more efficient process. So the SBA is still working on EIDL money, and I know that's not EDA, but it's EIDL money for disaster. They're way behind PPP, and I have already encouraged them to move to a more public-private partnership and getting the funds out. I hope we can do some of those same things with EDA and all of our programs, because it's just much more efficient.
Well, thank you. Again, just want to remind you, if you do have further questions, please drop those in the chat. We'll be getting to those in just a moment. So our last question that was pre-submitted is, local governments are being hit very hard with tax revenue declines, particularly those disproportionately weighed towards meals and lodging. In Montgomery County, Christiansburg is most vulnerable, as well as Blacksburg. Counties typically do not receive nearly as much of the revenue from meals and lodging, since these establishments are often located within the towns or cities. What do you think about including support to local governments for the steep decline in revenue in forthcoming federal relief packages?
I will certainly look at it. I'm not, and I like the way the question was phrased. I'm not against the concept, particularly when it comes to meals and lodging. That will never come back. When you look at the sales tax on furniture sales and some of the other things, they're certainly lagging, but those have an opportunity to come back. I was speaking with somebody recently and talking about that, and the person actually said, as I said, if somebody's waiting to buy a new couch, they'll go buy it. And she started laughing, and she said, yeah, I broke a lamp last week and I'm just waiting for the stores to open and I'll buy a new lamp. Those monies will eventually come into the state, but meals and lodging is lost. You're not going to go back and eat 5 meals today because you missed a meal back in March. Nobody's going to do that. So I think that's a very appropriate place to look. Here's the fear, and I don't want to mislead anybody. There's already been a push, particularly in major metropolitan areas, to restore the exemption 100% for state and local taxes. I can't vote for that. And to give you some idea, we had it up to, we gave an exemption when we did the tax relief and economic stimulus through tax relief a couple of years ago. We had an exemption in there that says you up to $10,000 on state and local taxes. In Southwest Virginia, my hometown of Salem has the highest tax rate. You would still not pay any taxes unless you owned a house over $864,000. Now, I'm sure there must be some houses worth more than that around here. I don't know where they're at. So we're talking about giving tax relief to the very wealthiest. And I know that they have higher real estate costs in New York City and San Francisco, but I don't think we should be subsidizing out of the 9th District those particular things. Now, if we're looking at losses for meals and, if it specifically says meals and lodging, I think I'd probably be okay with that. While the taxpayer ultimately nationally would have to pay that back, I do think local governments have some need, and I think it's legitimate that we're probably, as this thing continues, it's already longer than I had hoped. As we come out of it, we're going to have to assess those needs across the country. Problem is, I got to see the bill, because if they throw some stuff in there that tilts towards the wealthier communities, as opposed to ours, in Montgomery County and Roanoke County and Salem are the wealthiest part of the 9th. So when I talk about this, it's, there are lots of places in my district that can both use the help, but can't afford to be subsidizing. Long Island, New York, San Francisco, Los Angeles, places where relative wealth is considerably more than it is in the 9th District. So I'm going to have to take a look at it and see where we go. So I don't want to tell you absolutely yes, but I do think it's something we're going to have to consider, debate, and come up with the best plan we can.
Thank you. All right, we have a couple questions here in the chat. The first one is from Catherine Potter with the Virginia Tech Foundation. And she says, as an attorney, I'm concerned about the negative impact that COVID-19 lawsuits will have on the ability of businesses to open. Can you tell us what congressional bills are currently being considered to limit COVID-19 liability? And in your opinion, what are the chances of this legislation passing?
I'm gonna twist the question a little bit, and that's because there's not a clear answer at this point. There are some minor pieces that have been put in place to give some protection from lawsuits, but nothing significant. And we need to be, and I understand there's some risk, and I understand there's some people who wouldn't be able to go back because they're in an age bracket or they have comorbidities who serve in Congress. But the U.S. Senate is going back. They are typically older than the U.S. House and have more likelihood of being suspect. They're going back next week. We were supposed to go back next week. We're not going back next week. And they're working on another package, but nobody on our side of the aisle has been told what's going to be in it. So I can't answer that because that has not been shared by the majority party. But I think we need to be there. We need to be, conversing with one another. We can stay 6 feet apart. We proved when we went in and did the new money for PPP and for some of the other things out there, hospitals and some more for EIDL. We proved that we can cast votes on the floor. We can have, there was a committee that actually met. We need to start having our committee meetings, because right now we're doing nothing. We have done nothing except COVID since mid-March. I think that was appropriate for a time, but we have to get back to doing work, because your question is very legitimate. It's appropriate for us to take a look at how we protect businesses that are trying to reopen and get the economy started from being have lawsuits filed against them. We have situations at our nursing homes where 2 of the worst hit in Virginia. All the evidence, and this comes from both sides, it's not just me. I've gotten most of my information off those calls I was telling you about that the governor has been very gracious to hold and has been very helpful to hold every week with the congressional delegation. Those nursing homes didn't do anything wrong. It's just that they had a population that was so vulnerable that when somebody came in who was asymptomatic, didn't even have a fever, all of a sudden you have 10 to 40 deaths. That's not something that the nursing homes are going to be able to defend against per se. I mean, they can argue that they did everything right, but it's going to cost a lot of money to defend. We need to try to figure out how we can both keep people's right to access the courts when somebody is truly negligent, acting arbitrary and capricious, and there's gross negligence. People have to have access to the courts. On the other side of that coin, we need to make sure that people are just trying to do the right thing don't get sued because they were doing the right thing. So I don't have an easy answer for you, but I think the real answer is we need to be in DC discussing this. The Judiciary Committee needs to meet, the Health Committee needs to meet, and we need to meet live where we can talk to one another, even if 6 feet apart and spread out. And I've been working on a plan that will help us do those committee meetings. I was asked to try to come up with some stuff by the chairman, because they know I love rules and so forth, and I'm trying to do it where we can both follow the rules of the House and practice social distancing. So we're working on, we may have to have the public do it by video and have the members spread out across what previously would have been the territory where you would have had the public viewing. It's not ideal, but if it means we can get back together and start debating these very issues, I think it's well worth it. But that's one that needs to be debated, and there's probably another 100 to 200 that we need to be debating right now. Instead of, as much as I love being with you all, I think I need to be in DC trying to make the decisions that would answer a lot of these questions.
Thank you. The last question we have is from Gary with the Citizens Telephone Cooperative. And he says it's a twofold question. Those states who has chosen to do a soft opening, what does their state legislation do if they have a reported case spike? And second, if Virginia had a soft opening in May or June, what should individuals with low immune systems, going back to that question, do relative to going back into the workforce?
Yeah, first, I think that most of the states, it's being done by executive action to reopen and to do their soft openings, and so the executive can come in. I also think that just like in Virginia, many states need to look regionally. In all fairness to the governor, Northern Virginia is not ready to reopen. Their caseload is still fairly high. I think Southwest can reopen. I can't speak to the rest of the state because this is the territory that I pay attention to all the numbers on. But I think we could do a soft opening, but we have to be careful. We haven't had a lot of cases. We have natural social distancing because of the space in between our folks in many ways. I think everybody needs to be very careful. And if you see a spike, then the executive is the governor of the state is going to have to come in and say, okay, we'll have to slow it down a little bit or do a little bit of this. I think also, we've got to look at things, and the governor's got a commission to do this. We've got to look at things like if we open our restaurants open again, well, maybe each table has to be 6 feet away from the other table so that a family unit can eat dinner, but they're 6 feet away from the next family unit, or whomever may be there. That's still going to impact the revenues, and it's still going to impact meals and lodging taxes to a certain extent. But at least we can get started and see, and then if that works out and we don't see a spike, then maybe you can move a little closer. But I think we have to take it in steps. I think that's what the governor's team is going to come out with, but I think Southwest Virginia is ready to start experimenting with some of that. And but again, if I were the governor, he's right. I don't think, looking at just some of the numbers I've seen in Fairfax and those counties, while they have a bigger population, they also have a higher count per 100,000 people. I think it's time for us to open up. The Roanoke Times did a great job of laying all that out. I think it was yesterday or the day before. We sent that to the governor's office so they could peruse it. But I think it needs to be looked at regionally, and then we can have a better chance of not creating a huge second spike or second bounce, as I like to call it.
Well, thank you. I have received one more question, and it kind of ties into a question you've already addressed a little bit. And it's, how can we help supply private businesses such as childcare and nursing homes with PPE?
I know that the governor has purchased a fair amount. One of the providers in one of the new suppliers in Southwest Virginia has sent, should be today, 100,000 masks to the state. And I would say that, the state, we sent, in the CARES Act, we've sent $3.3 billion to the Commonwealth of Virginia. They've already received $1.6 billion. I think the governor's got some money to help out on like child care facilities and that kind of thing with masks. They can't do everything, but with masks and so forth, there's sufficient funds there. That's why we gave it to the states to figure out, all right, here's, for Virginia, $3.3 billion, figure out what your state needs and how you need to do it. I would encourage the governor, and I will try to remember to encourage the governor this evening. We have another one of our calls to maybe look at that. Write that down for me. And yeah, it's one of those things. We've got lots of meetings today. If I don't write it down, I'll forget. But I will try to encourage the governor to look at that. That makes sense to me as a place that we ought to be doing something. Production, we have production that I know of in Russell County, Salem. Saw in the news yesterday that Volvo's doing some masks. We have production in Martinsville, and we have 2 in Salem. I knew I was thinking of another one. I was trying to remember where it was. But we have 2 in Salem, 1 in Martinsville, and 1 in Lebanon that I know of for sure. And then we have a lot of people doing masks, particularly, that are doing it as a volunteer basis. But if they'll contact our office, we can give them a list of all the names we know of if they want to acquire some. But I understand that for a lot of these daycares and child care centers, cost is another issue.
Thank you. All right, our final question is actually final question this time is about the idle funds. So we know that idle funds have been ready earlier in this week, and we applaud the improvements made by the SBA. But when will idle open again?
Okay, that's probably a JR question. We don't have him on the line. Emily, Michael, that one comes to you.
That definitely is a JR question. I have not heard anything recently about an expected timeline, but we can check in. I'll check in with our small business expert, and we can let you know if he has any intel.
All right, so here's what I would ask you to do. Contact our office, put attention JR, and then say from Montgomery County Chamber this morning, and we'll get you an answer today. JR will probably have the answer, and I probably should have insisted he be on the call too, but he's been on a lot of the calls, and we've tried to give him a little bit of a break.
Well, thank you. We will definitely do that.
Yeah. And let me say, if anybody else has another question they think of later, or if there's a problem they see in the system somewhere, please let us know. All of my folks are working from home in the DC office, and mostly from home in the district office, and this is what they're doing now, is troubleshooting and trying to figure out ways to solve this.
Well, we appreciate all that you're doing. We have a follow-up question
Yep.
About EIDL. So the PPP and EIDL programs have been great for small businesses, but it's worth noting that 501c6 organizations, such as the Chamber, the Roanoke Blacksburg Tech Council, have served as vital liaisons, and C6s are ineligible for these programs. Is there any conversation about grouping us into any eligibility?
There has been a lot of conversation. As we do another bill, I would expect that conversation to continue. There have been a lot of push in our various conferences with the administration to try to see if we can't figure out a way that they can administratively fix that, particularly for chambers and other organizations like that. I'm not sure it appears we have to do legislation. That much is clear. And I'm not sure why it wasn't included in the package that we did last week to do some tweaks. But what happens is, in the back room, big fights happen, and one side may say, well, if you're going to do that for the chambers, that's seen as pro-business. We want you to do something over here. And when the fight starts and everybody says, okay, we got to get this bill passed, both of those have to wait for another day. So I know it's being discussed. It is one of the hot issues. How we get to a resolution, I don't have a clear vision for you. I'm sorry.
Well, thank you for continuing to discuss that one
Yes, ma'am.
as well. Do we have any final wrap-up questions? Give it just a second.
Yep.
All right, well, if we don't have any more questions, thank you again, Congressman, for
Thank you.
being here this morning, for spending time with us, and thank you to your staff as well. And thank you for continuing to advocate for us. Thank you again to ServPro for sponsoring this morning. And like the Congressman said, if you have questions, please send those to his office. Also, you can send those to the chamber. We're here to advocate for you in any way that we can. Also, if you do have questions specifically about PPP, EIDL, those programs, we have a lot of resources on our website. So please make sure to check that out as well. But thank you again for your time and have a great rest of your day.
Thanks.